My name is Alex Holbrook. This is my community health presentation for Indiana State University LPN to BSN program, addressing vaccination barriers and hesitancy among Hispanics and African Americans. The following are the learning objectives for this presentation. Number 1, define immunity, active immunity, vaccine-induced immunity, and vaccine hesitancy. 2. Identify state guidelines pertaining to vaccination. 3. Identify groups at risk for vaccination refusal. 4. Identify cultural beliefs that influence vaccination administration. 5. Identify barriers to vaccination among minority groups. 6. Identify different strategies to promoting vaccination compliance. Before we begin, please click the link below and complete the pre-test. After you have completed the test, please resume the presentation. There will be another test following the presentation. Immunity describes the ability of the body to protect itself from infectious disease. Active immunity describes the body's reaction to an invading organism by producing antibodies to fight infection. Vaccine-induced immunity describes the method of providing immunity by introducing a dead or weakened form of the infectious disease through a vaccine. Indiana Code states that children may not attend public school without proof of vaccination status, with a few exceptions. For example, a delay of vaccine through extreme circumstances, medical or religious exemption that is submitted by a parent or physician. There are currently no federal laws governing vaccination for children. The laws are decided by state. These are the required vaccinations to attend public school in Indiana. Here are some common adult vaccinations: seasonal influenza, shingles for adults 50 and older, pneumococcal for adults 65 and older, and Tdap if not already vaccinated as a child. I would now like to discuss barriers to vaccination. Despite evidence that vaccinations are effective at preventing disease, many Americans are hesitant to receive them. Some of the reasons include misinformation, fear of side effects, questioning the effectiveness of the vaccine. Vaccine hesitancy refers to apprehension or refusal of vaccines, despite availability. So this brings us to this question: why are racial and ethnic minorities at greater risk for declining vaccinations? Non-Hispanic Black Americans. There are several factors that may contribute to vaccine hesitancy among African Americans. For example, mistrust of medical procedures stemming from a history of unethical experimentation. In the past, there were medical experiments that were used on African Americans in order to determine if a medical treatment was safe. However, these were unethical. Mistrust of medical institutions resulting from years of systemic racism and segregation have also played a factor in vaccine hesitancy. Also, low socioeconomic status has contributed to vaccine hesitancy amongst African Americans. Hispanics or Latinos. Like African Americans, Hispanics and Latinos are at risk for vaccine hesitancy. They also may have lack of trust in medical institutions. Immigration status may also play a factor. For example, if a Hispanic is an illegal immigrant, they may feel apprehensive about receiving medical treatment or may not have access to treatment. Also, the language barrier can be an issue with vaccine hesitancy. For example, if the information provided is not in a clear language that they can understand, they may be hesitant or apathetic about receiving vaccinations. Also, as related with the immigration status, lack of access to care may play a role in this as well. Here are a few examples of vaccines that would be helpful for minorities. For example, COVID-19 vaccine. Although vaccination has been an ongoing debate for years, the COVID-19 pandemic and the vaccine has thrown fuel onto an already raging fire. In September 2021, a federal mandate was announced by the Biden administration requiring federal employees to be vaccinated. This was then extended to include businesses and companies with 100 or more employees, although there are exemptions and alternatives made available for those that do not wish to vaccinate. At the time of this presentation, only 58% of Americans have been fully vaccinated against COVID-19. This is a decisive issue, as many Americans feel that their rights are being violated by being forced into a vaccination that they do not want. So how does this pertain to Hispanics and Black Americans? When compared to non-Hispanic whites, African Americans are 2.8 times more likely to be hospitalized by COVID-19 and 2 times more likely to die from the infection. Hispanics and Latinos are 2.8 times more likely to be hospitalized and 2.3 times more likely to die as a result. Knowing this information, vaccination rates as of November 2021, only 35% of African Americans in the United States are fully vaccinated against COVID-19. Also, Hispanics and Latinos, only 41% of them are fully vaccinated against COVID-19. Despite these risks. I also wanted to discuss influenza vaccine. The CDC estimates that the flu kills anywhere from 12,000 to 52,000 people per year in the United States, and it accounts for 140,000 to 710,000 hospitalizations. Although African Americans had the highest incidence of ICU admissions for flu-related illnesses in the last 10 years, only 40% of African Americans received a vaccination in the 2019-2020 flu season. Latinos and Hispanics accounted for the third most ICU admissions, with only 39% of them receiving vaccinations. The most important tool that healthcare providers can use to promote vaccination is education. Providing clear, easy to understand information to patients will give them the tools to make decisions about protecting themselves with vaccines. It is also the duty of healthcare providers to combat misinformation regarding these vaccinations. In order to break the barriers, healthcare providers need to promote vaccinations for the ethnic and minority groups. This can be done by addressing any concerns about vaccines and promoting the vaccine confidence. As stated before, with a long history of medical institution mistrust and government mistrust from African Americans, this puts them at a greater risk for not receiving vaccines. In order to combat that, we need to address any concerns that they may have about these vaccinations in the clinical setting. Also, healthcare providers need to respect cultural preferences and beliefs. This can be done by establishing a patient-provider relationship based on trust. After establishing this patient-provider relationship, boundaries need to be respected. This includes avoiding browbeating. Trying to coerce a patient into receiving a vaccination by belittling them or making them feel inferior for refusing it is not very sensitive to cultural beliefs or ethnicities. Also, language barriers need to be acknowledged. Hispanics and Latinos that do not have English as their native language need specialized information given to them so they can make the best decisions. Also, in order to give these vaccinations, depending on the hospital policy or CDC guidelines, if consent is needed, it needs to be obtained before giving the vaccinations. Thank you for listening to this presentation. Please complete the post test in the link below.